Good evening, everyone. Welcome back to You and Your Health. Thank you for tuning into our program this evening. If you're watching the program for the first time, my name is Erika Roberts, a co-host of this program. And my other co-host is Dr. Edward Isserman. Hi, Dr. Eddie.
Hi, Erika.
How are you?
I'm fine. It's been a long time.
It's been a long time. I
Yeah.
know we haven't been on for a couple of weeks. I think all of our guests for June selected the end of the month.
Yeah.
So it's good to be back.
It's good to be back, and it's good to keep our people informed.
Yes, yes. And this evening we have one of our very own, Dr. Albert Kwashi Jr., a
ABC
dentist from the
Akure.
and his brother John is also in the back scene, helping us this evening as well. But he's back by popular demand. I believe most of you know him and his family. They've been part of the Ebenezer family for a very long time. And Dr. Kwashi will be discussing the various options for tooth replacement and how we can statistically, I should say, improve our smile. But before we get started, we want to thank our last speaker, Dr. Theodora Finn, for the discussion on gestational diabetes, a very important disease that occur in women. If you haven't watched that program, we suggest that you do so, along with the rest of the programs on our channel, the church Facebook channel, as well as the YouTube channel, channel 5112. And also, please do share the link with others so they too can benefit from it. So we miss Dr. Kwashi. We're happy he's taking time out of his busy schedule. So we're going to get started with him. And before he comes on, I'd like to tell you a little bit about his practice as well as his education. So Dr. Albert Kwashi Jr. is a general dentist at the Family Dental Care in Hyattsville, Maryland, where he treats patients with dental needs, improving endodontics, oral surgery, periodontics, implantology, worse big, cosmetics, cosmetics and pediatric care, excuse me. Dr. Kwashi received his Bachelor's of Science degree in 2002 from Yale University, where he majored in molecular and cellular developmental biology. He then completed his general practice residency at the Montefiore Medical Center in Bronx, New York, where he gained experience in all aspects of dental specialties, as well as emergency medicine and family medicine, anesthesiology and general surgery, with a very special focus in restoring dental implants, surgical extractions, bone grafts, and replacement therapy. Dr. Kwashi's drive and determination and compassion in caring for his clients earned him the accolade of being selected the resident of the year among 30 of his colleagues for excellence in patient care, diagnosis and treatment, and academics. Although running a family practice, he still finds time to do mission work, including providing dental services in Dominican Republic and participate in community activities such as health fairs and speaking with our youth. Dr. Kwashi belongs to multiple associations, including the American Dental Association and the Maryland State Dental Association, and has earned the title of an excellent dentist in our community in the state of Maryland. So we're excited to have him back. Dr. Kwashi, are you there?
Good evening, everybody. Busiafwe. It's true honor to be with you once again. I'm so grateful for Dr. Eddie and Erekoa extending this invitation to share more knowledge about dentistry and how we can improve our oral health. And I'm more than happy to bestow such knowledge. So thank you all once again for the invitation. I look forward to having a presentation filled with information that hopefully somebody can glean some knowledge from and hopefully gain tidbits to live a better life dentally. So that's what I'm here for.
Yeah, we're excited to have you back. Your last segment was very informative. As I mentioned earlier, you and Eddie had this bromance going on when I wasn't there, and we're glad that you can share your expertise on tooth replacement, because as you know, how people appear certainly affect their self-esteem as well as even financially in seeking work. So this is such an important topic at this time, and so we're grateful that you're able to take time out of your busy schedule, family, and your practice to be with us. So whenever you're ready, it's Okay, here we go. Your slides could be shared.
Yes, yes. All right. So thank you all once again for that great, glowing introduction. So last time I spoke with you all, we're basically talking about your general dental health and things that can cause your dental health to lack or to be in failing health, and also ways that you can improve it from a hygienic standpoint. So the focus of my presentation today is, if you've already gone past the point of losing teeth, what are some of your options to replace them? So as you see, dental restoration is your options for replacing missing teeth. And I'm also going to talk about aesthetic improvement of your teeth, because these days there are a lot of people coming in wanting aesthetics, whether it be bleaching or just kind of a better general look of their teeth. So hopefully you all can get some good information out of this presentation.
Thank you.
So as a refresher, a major cause of tooth loss is periodontal disease. And periodontal disease essentially is when you have an influx of bacteria that we all have in our mouths that you're not removing at an adequate level, which over time can start to break down not only your gum tissue, but your bone tissue, which essentially leads to the support of your teeth being compromised, and then ultimately leading to tooth loss. So the topics that I'm going to discuss in terms of those tooth replacements are going to be dentures, bridges, and implants. And as far as the aesthetic component, we're going to talk about crowns and veneers. So once again, just as a quick refresher, dental plaque, which is a sticky film that can coat the teeth and contains a lot of bacteria, forms at a pretty rapid pace in our mouths within every 2 to 3 hours after brushing. So that's why brushing and also having a diet which is high in good fruits and vegetables, and also having good oral hygiene habits is so important. And as I said before, you can extend your life by about 6.5 years just by having good flossing techniques. Bacteria that causes periodontal disease can, of course, be spread between people, and approximately 90% of systemic diseases have their links to the oral cavity, in particular diabetes and heart disease. And then people who have periodontal or gum disease often double their risk of having a fatal heart attack. So this is something that we don't always take as serious. You think it's just teeth, but it's something we really need to take seriously, because essentially your mouth is the portal to the inside of your body. So you want to make sure you keep that portal clean. So now we're going to, as a quick refresher as well, gingivitis. It's the inflammation of your gingival tissue, your gums that are surrounding your bone tissue. And this can be either hormonal or drug induced. And it is fortunately, a reversible condition in the mouth that with proper oral hygiene techniques, you can remove. But periodontal disease, unfortunately, is not reversible. So once you get to that point and teeth start getting removed or fall out on their own, that's when we need to talk about replacements. And this picture shows essentially someone who's in health, nice, strong pink gum tissue, and then someone who is not in health, where it's fiery red type gum tissue. Often we'll see bleeding upon brushing, which is usually a telltale sign that gum disease is starting or has already been active. And this is another image that shows a case of excess plaque buildup in the top image, and then once a cleaning, more than likely a deep scaling has been completed, and then the lower image. So there are techniques that we can use to try to maintain the teeth or to try to prevent tooth loss, but a lot of times if we get beyond that point, then we need to look at other measures to restore dental health. Plaque, as we know, in calculus build up and cause bone loss. 70% of tooth loss is attributed to its development. As I spoke earlier, you can have bleeding upon brushing, which is typically a sign of that periodontal disease. And cases, especially with diabetics, can be worsened when that systemic disease is present. Okay. And of course, this is a very obvious image of someone who has some pretty extensive periodontal disease, which more than likely is going to lead to multiple tooth loss in that particular case, which we're going to talk about what options you have to replace those teeth. And the image shows a person who's in health with nice bone levels, as well as nice healthy gum tissue. And then someone who is not in health, where you start losing that bone in proximity to the tooth, which especially once you start to lose it in between the roots, then definitely that tooth is going to start to get loose and then cause other issues. So all is not lost. Of course, we want to keep what God has given us, but in the event that we lose it, there are options to restore close to what he was able to create. And of course, once you lose the bone that supports the teeth, then you're at risk for tooth removal. Okay. So tooth replacements. First, we're going to talk about dentures. Dentures can be either complete or partial. Complete meaning it's replacing all of your missing teeth, and then partial meaning it's replacing some of your missing teeth. Now, dentures a lot of times have not only a physical, but a psychological component to them. Psychological meaning, especially if you are a bit younger, it can kind of make you feel as though you're getting old, because they're typically attributed to people who are in their elderly years who wear dentures. However, anyone of any age really can wear dentures. It's just a mode of replacing teeth that are missing. And dentures, I will tell you, are the most economical way of replacing teeth. But dentures do also have their limitations, which we'll get into. So dentures are removable appliances which replace some teeth if it's a partial, or all of the teeth if it's a complete denture. And the images on the right show patients who have dentures in place. Mm-hmm. So dentures, the indications for dentures. So whenever there's been extensive bone loss and periodontal disease, which we just discussed, extensive decay or abscesses, sometimes you may not have a whole lot of bone loss, but if you have extensive decay that has gone into the nerve of a tooth and it cannot be saved with the root canal, that could also be a reason for tooth removal. Patients who already are missing teeth, as the image you see on the right, which shows a patient that has no upper or lower teeth. And then also the financial resource limitation. As I was saying earlier, dentures are the most economical way of replacing teeth, but they can have their limitations. So we're going to get into some of those. And then also patients have to decide, what kind of investment you want to make into your mouth. Some of these more permanent solutions can be quite expensive, but when it comes to quality of life, I truly believe that there's really no price you can put on that. So we're going to get into that. So dentures. It's an extensive process, meaning there are multiple steps necessary in order to fabricate a good fitting denture. So the first step is going to be what we call the preliminary alginate impression. So it's a putty mixture that I'll essentially put in a tray that we custom fit to your mouth, and then we get impressions of your upper and lower arch. Now, these impressions are of someone who has all their teeth, but typically if you have some of your teeth or none of your teeth, this would still be our preliminary impression technique to at least capture the initial tissues to be replaced with teeth. The second part is what's called the wax bite and final impression. The first image shows a patient who has essentially what are called wax rims. These wax rims allow us to relate your upper jaw to your lower jaw so that we can, as accurately as possible, recreate your bite so that we don't cause any issues with your TMJ joint or temporomandibular joint due to improper occlusion. And the image in the middle shows those wax rims in isolation. And then the image on the right is what our final impression looks like. So that's an impression that is a bit more detailed to get a very accurate impression of your ridge so that we can get as accurately fitting a denture made as possible. And third step is what's called the wax try-in. So what you can see here, these are teeth that are set in wax. We're going to try these teeth in your mouth, essentially to see how they fit. We want to look at your bite. We want to look at your smile. A lot of patients are often scared of having what are called horse teeth. So we want to make sure that we make you look as natural as possible. We don't want any Mr. Eds out here. We want you to look exactly as how you're supposed to look. We can achieve all that through our wax try-in step. And then lastly is our delivery. Now, the delivery of an implant can be either a straight delivery where there are no extractions necessary, meaning all the teeth that need to be pulled have been pulled, or it can be done as what's called an immediate denture. Oftentimes, patients who need multiple teeth pulled do not want to have those teeth pulled and then have to wait for a denture to be made. So a lot of times we can actually pull the teeth and put the denture in at the exact same time, so they're never walking around for an excessive amount of time with no teeth. So the image on the far right shows a young man who had extensive decay in his upper front teeth that were pulled and then had an immediate denture put in place at the time of extraction. The image on the left shows a patient who's already completely edentulous or has no teeth, and then shows her with 2 dentures, one up, one down. And you can see in that image the importance of having teeth because it gives her face a much fuller appearance, can prevent, some wrinkle lines from forming around the lips due to lack of good lip support, and essentially can really help improve your confidence, your speech, and of course, your ability to eat. And, whether eating some good contumre, some dodo chi, Ghana jollof, because Ghana jollof is the best. You need to have those teeth too. You gotta have. We all know Ghana jollof is the best.
Yeah.
I just want to add that in there. Ghana fui. Number one.
This is 3 against 1, but it's okay.
It's all good. And then in addition, dentures can also be indicated with implants. So if you look at the image in the middle, there are times I can actually use implants to place into your jaw and then place a female component inside of the denture, the male component in the implant. And you can actually have implants that are snapped in. So this is an option when resources are limited, but you have the ability to at least have implants placed, because if you're able to have implants retaining your denture will actually retain far better, because if it's not moving due to movement of your lips or your tongue, you're going to get better usage out of those dentures. Okay. Now, when it comes to dentures, typical complaints are one, pain. So if you are somebody who is completely edentulous, meaning you have no teeth, then your denture is essentially holding on to your gums, whether it be your upper arch or your lower arch. Now, if you've never worn dentures before, in the interim, it can be a bit difficult to get used to wearing dentures, because you can imagine anything that you bite is now putting direct pressure on your gum. So a lot of times people who have dentures made will require multiple appointments of adjustments in order to get them to fit just right. Appearance, because they are sitting on top of your gums, at times they can appear a bit bulky in your mouth or make you have too much lip support. So which in that instance, I work hard to make sure that I can thin out what's called the flange or front area of the denture that sits over top of your gum, so that you have good lip support, but so that it doesn't look like something is fake in your mouth. Poor retention can happen in the maxillary or upper arch, or instability in the lower arch. Your upper denture is essentially held in by what's called mucostatic retention, which essentially is your saliva gluing that denture to your palate. So if that, let's say you're somebody who has a salivary issues due to some medically induced or medication induced xerostomia or dry mouth, that could make a denture very difficult to retain in your mouth. And for the lower denture, because your tongue is always moving as you're talking or eating, that at times can lift your denture up in the bottom. So that would be an indication potentially for having implants that can help retain that lower denture in, so when it snaps in, it doesn't move. Altered speech, depending on the fit of your denture, you can have a bit of air that can pass through underneath the denture, especially in the top. So sometimes you may get a little bit of a lisp, for which we have to make some alterations to your bite and the fit so that we can correct that. Inefficient chewing. So somebody who has a denture and doesn't have any more natural teeth, you lose about 75 to 80% of your bite force, which means you only have about 20 to 25% of your bite force. So a lot of denture patients may have issues biting into harder things like apples or maybe really hard sandwiches or bread. Of course, you shouldn't be chewing bones. You remember my message from last time, eat the meat, leave the bones alone. But you do lose a lot of bite force when you do have to wear dentures. And then gagging, because the upper denture needs to extend towards the back of the throat in order to get the best retention, that at times can stimulate patients' gag reflex, which can make a denture very uncomfortable to wear. So dentures are a great indication of getting you the most teeth, the most bang for your buck, because it's the most economical option out there, but there can be limitations. So with that, we're now going to get into some more fixed options. So first, we're going to talk about bridges. Now, bridges can work if you have two strong or healthy teeth adjacent to a space. So a bridge is a fixed appliance which uses your natural teeth as anchors in order to replace missing teeth permanently. So in the depiction on the left, you can see there's a tooth missing in the middle, two teeth, one tooth on either side of that space, upon which we can apply this bridge. Now, when it comes to bridges, there is a little bit of invasiveness involved because I do need to use those two teeth which are adjacent to the bridge as anchors. So I do need to trim them down, as you can see in that depiction. But once the bridge is on, you don't feel any adverse effects in terms of sensitivity or anything like that. You use those teeth just as you would any of your natural teeth. And then the image on the right shows a patient who had a bridge made in the front. So they were missing their upper lateral incisor, and then the bridge was placed in order to replace it. And you can have a very natural look with bridges. Now, when it comes to a bridge, because the teeth are connected, it does take a little bit more work to keep the teeth clean. So in that case, you may use a device called a water pick, which will be able to flush any kind of food or debris from underneath the bridge, or you could use a floss threader, which is a little bit more work to be able to get underneath the bridge for proper cleaning. Bridges also can help prevent drifting or shifting of teeth and can improve your ability to speak and chew normally. So these particular images is a case that I worked on a few weeks ago, and it was a very rewarding case. This young man is around the same age as me, about 40 years old, and was very, very low on self-esteem. I mean, all the teeth that were missing, he didn't like talking, just kind of had a general down outlook on life. And by the grace of God, he was able to come to me, and I was able to give him the option of having bridges, because in his case, implants would have been a bit too cost prohibitive. So we use multiple teeth as anchors. As you can see, these teeth have been shaved down, and then the image on the far right shows his bridges in place. And needless to say, this guy's on top of the moon. I mean, I'm not the smallest guy, and this guy is talking about he could take me. So definitely his confidence has risen dramatically. Now, his ability to take me is not very high, but still, teeth can give you confidence. So I was very happy that I was able to achieve this result for him.
Yeah, the outcome looks very good.
Thank you. Thank you. Next. Now, this is another very rewarding case. This young lady had all of her teeth in the top missing, except her two teeth in the middle or in the front, her two incisors. Was also very conscious of her mouth, would always smile with her hand over her mouth. Unfortunately for her, I was able to place 4 implants, and she was able to get a bridge on those implants. So the image you see on the right is actually a temporary bridge. So that's not even her final, but needless to say, even in her temporary, she too is just over the moon. So, dentistry, I'm so blessed to have had a father who, may he rest in peace, encouraged me to join this profession, because it's very rewarding when you can get these kind of outcomes for patients who are otherwise not knowing where else they can turn. So yes, it's a true, true blessing that I do not take for granted. And it's another patient. So this patient as well, multiple missing teeth. We used 1, 2, 3, 4, 5 teeth as anchors and trimmed them down and fabricated the bridge that you see on the right. And this is just my joy. So very grateful to have achieved this. Okay. Now we're going to talk about dental implants. This is my true passion right here. True passion. So dental implants are titanium cylinders placed into the jawbone, which act as anchors to hold fixed teeth, which are permanent. Indications for implants are going to be situations upon which you don't have 2 healthy teeth, let's say, in order to do a bridge on your natural teeth, or if you don't have 2 healthy teeth on both sides of the space. So let's say you are missing your back molars, but you don't have any teeth. You don't have the teeth in the back to be able to connect to a conventional bridge, then you can use implants for bridges. But what I'm getting a lot of lately is actually more full mouth rehab cases where patients who have no teeth don't want to go for the denture option and are getting implants placed that can replace all of their teeth permanently. Keep going. So this is a patient who was missing actually she had her teeth, but we had to have a come to Jesus moment where I had to tell her, hey, these teeth, they're no good to you anymore. She had some pretty severe periodontal disease. So I pulled all of her teeth and placed 4 implants in the lower arch, 4 implants in her upper arch, and then we were able to achieve this result. It's coming there. Oh man, and this lady
that looks very good.
Oh man, this lady said,
Beautiful.
if my husband gets mad at me for gaining COVID weight, she said, I don't care. I will gain the weight, no problem. I said, please, go and eat your food well.
She actually looks much younger. The lip function looks much younger than.
Great observation on your part. Teeth have worked wonders in terms of age and in terms of giving you a much more youthful appearance. So, I mean, this lady felt like she was back in her teenage years, needless to say. So, her husband better be careful. He better behave himself. Go ahead.
Okay.
Now, dental implants, they do not rely on your natural teeth for support. So your other teeth are not involved in being trimmed down. Their long-term viability is very good. Essentially, what happens with implants is a process called osseointegration, where the implant is coated with the surface that will stimulate cells in your bone called osteoblasts to grow and fuse to that implant cylinder. That process takes about 2 to 3 months. So it is a commitment in terms of time. You'll see a lot of places talk about teeth in a day. That's not really telling the truth. I mean, you can give temporary teeth, but the final teeth will usually be a couple months down the road. But once the implant has healed in your bone, I mean, as long as you have good oral hygiene, they're there to stay. So that's the beauty of implants. Also, they can be a bit more than the initial cost of a conventional bridge, but they do have a typical longer lifespan. So conventional bridges on your natural teeth, literature says about 7 to 15 years, although if you're taking care of your bridge, there's no reason you can't wear it longer. Whereas implants, you can go up to even 25 or even longer. All of these things, once you commit to this kind of work, it's really about how much you really want to protect your investment. So it's just like you buy a nice car, you want to keep it washed and clean, or you get a new home, you want to keep it clean. You get new teeth, you want to keep them clean as well. So you just want to make sure that if you're going to invest money in these kind of things, that you are doing your best to keep those things maintained. So this is another case that I completed about a week ago. So this lady, she had same come to Jesus moment. We had to pull all of her lower teeth, about 18 teeth to be exact. On her lower, we pulled all 16 of her teeth on the bottom. On the top, but 16 on the bottom, because you have 16 up and down. Then she healed. And luckily for her, because of masks, she didn't mind, just wearing the mask while healing. So we placed the 4 implants. Those metal studs you see poking up are what are called abutments. The implants are in the bone. You can't see those. And then that is her bridge on top. And I mean, this gets you to looking and feeling the way you were before you ever lost teeth. So that's the true beauty of implants and why I really enjoy them so much, because they can really restore you to the way you were before you ever lost teeth and really kind of give you a new lease on life. Now we're going to get into the aesthetic options in dentistry. I've seen a lot. You can go on Instagram, Facebook, and any social media outlets. Everybody's trying to get that look, whether it's their body or whether it's their teeth. So I'm getting a lot of cases of people who are wanting more aesthetic options in order to improve their smile. So the 2 primary aesthetic options are going to be your crowns or veneers. So a crown is a cover or a cap that a dentist can place over top of your tooth. That crown can restore damaged or missing tooth structure to its normal shape, size, and function. And then a crown can also protect your tooth and improve the way that it looks. Now, dental veneer is almost strictly cosmetic. It can have some corrective nature to it, but pretty much is for getting the look of a very ideal smile. So what a veneer is, it's a thin wafer of porcelain. Essentially looks like a shell that we're going to glue to the front of your tooth, essentially after doing some mild shaving on the front of your tooth. And what a veneer can do is it can give you ideal shape of your teeth, ideal length, and also a permanent color. So if you're looking to bleach your teeth, but maybe you're concerned about, well, I have a diet that's high in coffee, tea, wine, or any of those kind of things, you can have veneers where you can have a color that's permanent, that won't change, it's resistant to all those kind of things. And then those shells or veneers are bonded to the front of the teeth, and they can change the color, shape, size, or length of your teeth. So starting with crowns, this gentleman came in and he was very unhappy with the appearance of his two front teeth. As you can see, he's got a significant amount of crowding with his two central incisors in the upper arch. Now, in this case, there would have been two options. He could have either undergone orthodontic treatment, which could have straightened those teeth out, but may have required extraction of his premolars in order to create space to move those teeth back and into his arch alignment. But what he chose instead was to have crowns placed. Now, in his case, it was a bit more advanced because the excessive protrusion of those teeth or sticking out of those teeth caused me to have to do elective root canals and then do his crowns. Now, that's not the case for everybody who's getting crowns, but in his case, because of the amount of tooth structure we had to cut down, I had to do root canals first so that he wouldn't have any pain post-operatively before we did our crowns. And needless to say, the image on the right, I mean, this guy is so happy. He doesn't even normally smile. He has had a permanent smile on his face when he left the office. I had to tell him to close his mouth so the cicada wouldn't fly in. You know? This kid is great. So, the brother, please close on the outside. So, I mean, this guy is just smiling from ear to ear. So very happy we were able to achieve that. Okay, next. And this is an image of veneers. So this lady had multiple spaces in her teeth. And as you can see, she had some previous dental work done. And those crowns are a bit wider than her natural teeth. You can see the stark difference between her natural teeth and those crowns or previous dental work that she had. So the depiction in the upper part of the image shows those thin wafers that we glued directly to the front of those teeth. And in the image on the right is the result that I was able to get for her. So we'll be doing some more veneers on her lower arch, but needless to say, this upper arch, she is incredibly happy with the outcome that we're able to achieve. And she's excited to get more work done.
Yeah, it looks very natural.
Yes, that's number one. Erekwa, you are on point, my sister. I thank you. Natural is the key to the game. We never want to do anything that's going to look like I've done something to you. Like, right. I want any work that I do to look like that's what God put in your mouth. So that will give you the most confidence in knowing that you can kind of get back to a normal way of smiling, eating, talking without people looking at you like, something different. I don't know. You know, you want them to be like, it looks good. So it's very important to achieve that natural look. All right, so we come to the end of our presentation. So the main thing that I want to leave everybody with is that with anything, I always am a firm believer in the fact that your health is your wealth. If you are healthy, then there's so many things you can do in this world. If you are not, it really limits your ability to do many things. And I believe that we've all been blessed with many gifts and talents, and you want to be at your best to be able to not only manifest those talents in this world, but to do them to the best of your ability. So dentistry can be expensive. A lot of dental insurances do cover many dental procedures, but a lot of this work, especially big time implant work, they may not cover. So it really becomes a matter of how much you want to invest in your mouth and how much you want your quality of living to be improved. Can be expensive, but honestly, like I said, I mean, there's no price you can put on comfort, peace of mind, and being able to live your life the way that you want to. So those are the main nuggets I want to leave with everybody. So I thank you all. Some of these images you saw last time, of course, that's my father, Dr. Albert Kwashi Sr., who is now in glory with me as a baby. And I think what he was saying is my son, you will be a dentist. Don't worry. Right now, all you want is breast milk. But your time will come. And then in the middle, one of my happiest days, of course, next to marrying my darling wife, Odoye. Graduation with my beautiful mother and my brother. Image on the bottom left corner is my son and Yvette and I, and in the middle is little Albie, Albert III, with Yvette and myself. And then upper right corner, that's John and I, little boys, probably doing something mischievous. Now boys in bed. And then my beautiful mom with us in the lower right-hand corner. So, as always, midasi pi nyamishra way. Thank you so much. God bless you all. And always available to any of you. We're located 3331 Toledo Terrace in Hyattsville, Maryland, Suite 308. Office phone number 301-559-1500. There may be, when you call, a little bit backup in terms of appointments. Because of COVID, there's been a backlog on our schedule in general. So please don't let that upset you or discourage you. I'm here, ready and willing to take care of all of your dental needs. And believe me, once I get my hands on you, you will never be disappointed. In Jesus' mighty name.
Amen.
Yeah.
Dr.
All
Kwashi,
right.
thank you. Thank you so much for this excellent presentation.
We have.
You're welcome.
So
Do we
some
have
few
questions?
that we have.
Sure.
Yeah, a lot.
Okay.
In
We can get
fact,
started on that.
I was recently diagnosed with periodontal disease. My periodontist mentioned that laser surgery would be an appropriate option for my treatment course. Is laser surgery safe? Is it as effective as traditional treatment courses?
Okay, so laser surgery is safe. Laser surgery can be very effective at really almost permanently killing a lot of the bacteria that leads to periodontal disease, because those bacteria will sit in pockets in between the teeth and the bone. So lasers are almost the only way that you can really effectively get deep into those pockets. And it is a specialty procedure that is going to be done by a periodontist. And I would say it would be more effective than just traditional scaling and root planing. So scaling and root planing will probably be done in addition to laser therapy. And laser therapy, it may not mean that your teeth will be as strong as previous, but it can surely help to halt any extensive periodontal disease. So it's not a bad thing to have done. I would highly recommend it, but sometimes it depends on how far gone the teeth are. If the bone support is too low, let's say you're below 30, 40% of bone holding the teeth in, then you may not look to have that procedure done. You may look to have something that's a bit more definitive in terms of removal and then replacement.
All right. So someone also asks, I wake up every morning to visit the washroom and I spit and I always find blood, red blood, but not black. Do I have periodontal disease?
I would more than likely say yes. The fact that it's red and not black means that it hasn't clotted, so it's a more active type of bleeding. So you probably have not only advanced stage of gingivitis, but could surely be some periodontal disease. So in that case, you definitely want to see your dentist as soon as possible. And other things that can also promote bleeding in your gums more. For instance, if you're somebody who's on a baby aspirin regimen as a mode of protecting against heart attack or stroke, that can make you more susceptible to bleeding. Or if you're on a blood thinner, so that can surely also make you more susceptible to bleeding. But definitely if you're waking up with blood, especially in your spit, that's usually a telltale sign of some form of periodontal disease. As far as the advancement of it, you can't necessarily tell unless you take x-rays to determine what kind of bone support you have. But definitely in such a situation, you want to get to your dental provider as soon as possible.
Okay. Someone is also asking, why is it that most of the teeth removals occur at the lower gum?
So I would say typically that's really dependent on gravity. So when we eat, most things that we eat tend to sit in the lower arch of our mouth. So if you're not removing it at an adequate rate in terms of brushing, flossing, you're probably going to see more tooth loss in the lower arch. Sometimes it depends on your eating pattern. Some people may only eat on a side out of habit. If you're right-handed, more eating on your right, or left-handed, more eating on the left. But I would say more than likely it's attributed to gravity and things just settling more into your lower arch. And then if you're not, like I said, cleaning well, you're going to have those teeth going out sooner than later.
Okay. Dr. Kwashi has kept me smiling. So you did not mention of fillings, but what are some of the materials used or materials used for fillings as a way of dental restoration?
Okay, that's actually a good question. So fillings are ways of replacing destroyed or decayed tooth structure. And depending on the level of destruction or decay, a filling can be a fine restoration in order to restore form and function. So there are times I can actually do fillings on front teeth that are actually aesthetic fillings. If, let's say, a veneer is outside of somebody's budget, you could do composite veneers, which can still give you a nice look. But they're not going to be as resistant to stain and could be a little bit more prone to breakage. But typically, the main restorative material I use when it comes to fillings is composite or tooth color material. An older material that a lot of patients still have in their mouths is called amalgam, which is the more silver, or over time will look like a black restoration. A lot of times, I really don't recommend that people necessarily get them removed. Some patients think that, oh, I need to get them removed because they've been a thing. To be honest, once the filling has been packed in your mouth, the mercury evaporates. So a mercury or amalgam filling being in your mouth is not toxic to you, but over time they can be susceptible to breakage. And if they do break, usually they break in large amounts. So in that case, you may be a candidate for a crown. But amalgams I don't do anymore. Everything now is all aesthetic with white colored fillings because patients want to look as natural as possible.
Okay.
I
So
think that was one of the concerns from pregnant women in the past, the Magnum, because of the mercury that may be released.
Right. So a lot of times, even in that kind of situation, it depends on the stage of pregnancy as well, because a lot of times we want to put off any technically elective work till, second trimester. So in that kind of case, a lot of it's peace of mind. Like I said, you can't put a price on peace of mind. I don't mind replacing them because, of course, you're going to get a better look and may have better longevity in terms of them staying where they are. But a lot of times, if there's nothing wrong with it, I don't typically recommend that a patient removes it.
So, Erika, do you have something?
Yes. So you've mentioned several times about cost. And I'm just curious as to the cost of having a bridge versus an implant. There are major costs in that.
So it really depends on demographics. So for instance, a crown or a bridge or an implant in Hyattsville, where I'm located, is going to be a different price than Rockville, Bethesda, or Potomac. But my office in particular, for an implant start to finish for a single tooth is $2,500. So the implant in your bone is $1,000. The crown that's going to go on top of that is another $1,000. And then the abutment or anchor that screws into the implant that the crown sits on top of is $500. So that's what comprises the $2,500. But that is a process that is over a period of time. So it's not like you come day one and I say, come on, give me $2,500. No, that's not the way it works. Typically you'll start with a deposit, and then I'll be seeing you once a month to track the healing of that implant. And then once we get to about the 3 to 4 month time span, then we'll look at restoring that tooth. So it gives you time to pay it off. And there are a lot of third-party financing options, whether it be Care Credit or some other options out there. Now for a crown, typically you're looking at anywhere between about $950 to about $1,200. That's somebody that's strictly out of pocket, no insurance. But our office is a heavy insurance office. So typically, if insurance is footing some of that cost, which is usually about 50%, then insurance-wise, your out-of-pocket cost could be anywhere between, let's say, $250 to maybe $450. So insurance definitely does help. But if we're getting, I'm sorry, go ahead.
Do you have any preferred insurance company?
I would say the top insurances that will really give the patient the best benefit are going to be GEHA, which is GEHA, Aetna, MetLife, and Blue Cross and Blue Shield is actually pretty good as well.
Okay.
So Aetna, MetLife, GEHA, Blue Cross Blue Shield.
Okay.
So I'm not sure if this was covered the last segment since I wasn't on, but can periodontal disease affect the brain, like cause infection in the brain?
Good question. So it can, in the sense of abscess formation. So periodontal disease, right, is linked to the influx or overgrowth of bacteria, which destroys the bone that supports the teeth in your mouth. Now, if that periodontal disease goes untreated, it can first and foremost lead to heart disease, because if you can imagine, everything you eat or drink is passing through your mouth. That bacteria is then being ingested and then can get into valves of your heart, which can then cause destruction of heart valves. Now, when it comes to your brain, and unfortunately, there was a case some years back of a young man, Diamante Driver, in Baltimore, who had an abscess, which unfortunately, probably due to lack of economics and resources, never got that abscess treated. It did expand into his brain, and he died. Now, for an abscess to expand into your brain, I mean, that takes a really long time, and it takes a lot of neglect. I mean, you would have missed all kinds of signs of pain, swelling, even pus formation. So the likelihood of that happening is relatively lower unless you're really just not taking care of your health. So it is something that is possible, but you really gotta listen to your body. And when it's talking to you, when it's pain, you see swelling, you gotta get it addressed as soon as possible.
Okay. All right. I have one more question. In terms of bridges, how frequent does that need to be changed?
So literature would say anywhere between 7 to 15 years. Insurances will essentially pay for replacement of a bridge. I believe anywhere 7 to 10 years. But to be honest, I mean, I have bridges in my mouth I've had since I was like 18, and I'm 41 now, and I've never had it replaced. So it's really a matter of how well you take care of it. It's really a matter of how often you're seeing your dentist, because your dentist are going to be taking x-rays to make sure that the teeth supporting that bridge don't have any decay underneath them. And it's really about your oral hygiene methods. As long as you are flossing regularly, brushing regularly, using an antiseptic rinse to kill out of that bacteria that leads to periodontal disease. As long as the teeth supporting that bridge remain strong, there's no reason you can't wear it beyond, what literature tells us.
Okay. And how painful is both of them? The bridges and particularly the implants. It looks very painful in the picture.
Yeah. So, today I actually placed a total of 3 implants today. So both of those patients didn't sleep all night, just anxious, scared about the placement. Honestly, it's not that painful at all. Whenever I place the implant, I'm always going to give you ample amount of anesthesia. So whether I'm doing a root canal, crown, filling, it's the same kind of anesthesia I'm giving you. Unfortunately, in my office, in terms of any kind of sedative measures, I can really only do oral sedation, which is going to be volume, essentially, where you could take the previous night. Then somebody would bring you in the morning. So it just kind of makes you more comfortable, really lowers your anxiety level, but it doesn't put you totally to sleep. So when it comes to doing implants, if it's an area where, let's say I'm pulling a tooth and immediately placing an implant, that's really even less painful because the hole for the implant is already there. I'm just making the hole a little deeper and placing the implant. If it's a place where you've already been missing a tooth and it's just fresh bone, I am making a hole to put the implant in. If anything, you might feel pressure in terms of the drill penetrating the bone. But in such a case there as well, the implant is so small, much smaller than a natural tooth, that the pain is really minimal to none. And even these 2 patients I saw today experienced no pain the entire procedure. And if anything, you may experience some pain that night and then maybe a little bit into the day the next day. But beyond that, it's rare that I have a patient who's had pain beyond 2 or 3 days.
Okay.
And a bridge, there's really no pain at all, because once you get numb and then have your teeth trimmed down and the bridge put on top, there's really no pain associated with that. Potentially maybe a little sensitivity, but once the bridge is seated and kind of sets in your mouth, that sensitivity goes away.
Okay. So one last question. What are some of the things that people should watch out for to prevent periodontal diseases? So like some of the pics that you showed, it looked like it's gone far enough where they actually needed this implant. So what are some of the causes that kind of led to that?
Right. So essentially it's just plaque buildup, and plaque is essentially going to be residual debris from food that we eat. So if you let it sit over an extended period of time, it's going to set on your teeth and then become what's called calculus. Once it gets to the point of calculus, it's a hard deposit that you can't remove off your teeth. And once that sets in, then the bacteria that's associated with that calculus is going to start to go to work, where it's going to start to seep down into the crevices between your teeth and bone, and then start to cause that bone to recede, and then you start to lose teeth. So essentially, to stop that whole process from happening, it's just a daily process. Just like every day we take a shower, put clothes on, you got to brush your teeth. And all it requires, honestly, is a total of 6 minutes a day, which means 2 to 3 minutes in the morning, 2 to 3 minutes in the evening, which is the last thing you do before you go to sleep. If you get an afternoon brush in for 3, that's a bonus. But if you at least do morning and night, you're good to go. And then, of course, adding an implement beyond that, which is going to be your dental floss or a water pick. A water pick is essentially a water flosser, and water can essentially permeate through anything. So the joy of the water pick is that it's going to be able to get deep into those pockets where bacteria can be caught or food or any kind of debris. Traditional floss is, of course, our most basic implement for cleaning between our teeth, because a toothbrush is not so accurate at getting between the teeth. But as you get further back in your mouth, it can be a bit more difficult to floss back there. So whether you're doing traditional floss around your fingers, or if you're using like a floss pick where it's kind of a stick that has floss in the middle of it that you can use to kind of reach those back areas, can still be a little difficult. So for me, I personally use a water pick daily. And if you use it once a day, and that's really sufficient to keep the teeth and gums healthy.
Okay. All right, thank you. Dr. Do you have more questions?
Yeah, just the last one. So finally, following a dental restoration, what do you recommend I do? Do I have to eat my bones with my napesi and
So I understand that as Africans, right? Or Caribbeans, it is a challenge to let go of old habits. So even my grandmother, God rest her soul as well, she had dentures, upper and lower dentures. It would still chew bones when she only had 20 to 25% bite force, but she didn't care. She would turn those bones into dust. I mean, it was amazing. Amazing. Grandma, you are wonderful. So, honestly, like I always talk about, it's about protecting the investment. The worst thing for me is for somebody to spend, a good amount of money to get their mouth looking the way that they want it to look. And then it gets messed up because you're just doing things you shouldn't be doing. Like you have veneers on their front teeth or crowns, and you're opening bottles with your teeth, or chewing these hard bones. People say, "Oh, but I can make the bone very soft." I said, "Yeah, forget that. Just eat the meat. The meat is as soft as can be."
Probably want the marrow with the
get the marrow. Take some B12. You get red blood cell synthesis, no problem. B complex, be all right. But I get it. I get it. It's hard for people to let go of. But honestly, I wouldn't be doing my part if I didn't at least say that. Because if somebody goes and chews bones and then breaks something, and I haven't said it, then that's on me. Because I haven't educated you as to what you need to do. But in terms of in general, like if you're getting a full mouth of implants and a bridge, if you're getting a natural tooth bridge, a crown or veneer, I mean, you can have a relatively normal diet. I mean, eating, like I said, sandwiches, chicken. It's really the harder things that you just want to be careful of, because these are man-made products. So nothing that a man can do is going to be as good as what God can do. So, we just need to be mindful of that. But I mean, these restorations are very strong. They are very sturdy. So you shouldn't have any fear that getting one of these is going to put you at risk for, breakage. But with anything, you just have to be careful.
So I saw this question. Do you have tips for those of us with sensitive teeth?
That's your brother.
Look at this.
What do you recommend for? Do you recommend veneers or dentures or crown or bridges for people with very sensitive teeth?
All right. So when it comes to sensitive teeth, we first have to diagnose what is the cause of that sensitivity. So it could be a couple of reasons. Could be extensive decay in the tooth, which is close to your nerve, which could cause sensitivity. That's going to lead to a root canal or an extraction if the decay is too extensive. Other forms of sensitivity could be if, let's say, you've brushed a little too hard over time and you've receded some of your gum tissue. If your gum tissue recedes, that's now going to expose your root surface, and your root surface has no enamel coating it, so that can lead to sensitivity. So in that case, there are a couple of things you can do. First, I'm always going to go on the conservative tip and have you try some chemotherapeutic. So that's going to be Sensodyne toothpaste. One in particular, there's Sensodyne Repair and Protect. and there's also a Sensodyne Rapid Relief. It has a higher content of what's called potassium nitrate, which can help to soothe any kind of sensitivity to hopefully prevent you from having that any further. Now, if the Sensodyne is not effective, then if need be, if there are areas where between the gum and the tooth there's extensive recession, then I can put fillings in those places. And the filling is essentially going to help insulate the nerve a little bit more so you don't have direct transmission of heat or temperature into the tooth. So those are going to be my first basic ways of using implements to help relieve sensitivity. Now, in terms of crowns, veneers, or bridges, a crown can relieve sensitivity. Let's say you have a lot of recession on a tooth. A filling might be too big in terms of trying to restore that. You could do a crown in that case, because a crown is not only aesthetic, but essentially is to help restore tooth structure that you've lost. So whether that tooth structure has been lost due to extensive restoration, extensive decay, or extensive wear, then a crown could be used in that situation. A veneer is not really something used for sensitivity. A veneer is strictly cosmetic, essentially in nature. So that really wouldn't be a way. And a bridge is really more for form and function. It can be aesthetic as well, especially if you're missing front teeth or you're missing teeth in your aesthetic zone. But a bridge is more for function in terms of allowing you to eat properly.
Okay. I have a question before the bottom question that we have, because I think we can close out on that question. It's very interesting. But do you, in terms of over-the-counter products, in terms of teeth whitening products, are they effective? And if so, which product would you recommend?
Fantastic question. So
somebody else asked, I think Ankardu actually asked, mouthwash and rinses as well.
Okay. Uncle Ado, hey. So I'll get to his question as well.
Okay.
So in terms of the sense of the whitening toothpaste honestly is just going to have a bit more abrasive in it to remove what are called extrinsic or surface stains. So if you're a coffee, tea, wine drinker, or let's say you eat a lot of grains, which can also create darkening of the teeth due to iron in them, you can use those whitening toothpaste to help remove some of those stains. But if you're talking about actually changing the true color of your teeth, which is an intrinsic or inside color of your teeth, of your tooth, whitening toothpaste is really not going to be that effective at really changing your tooth color, because the amount of bleach content that would have to be in it would be a bit dangerous for you to be brushing with, because you could cause a lot of trauma to your gums, because bleach, especially in-office bleaching, is quite strong and can cause gum burns. So we use barriers to help protect the gums from that kind of burn. So if you're going to use a whitening paste, you may want to use it after you've done some kind of whitening system, whether it be an over-the-counter whitening, which would be like your Crest white strips, or an in-office whitening, which is going to be a professional whitening. And there are various in-office whitening systems that can allow you to have a much whiter smile. So yeah, the toothpaste, it's kind of a misnomer. It's really more abrasives in those pastes that just help give you a more white appearance. But if you have excess staining on your teeth, it's going to look whiter anyway because of that real reason. Now, in terms of over-the-counter mouth rinses to use, Listerine is kind of the prototype as far as antiseptic rinses, or Crest Pro Health. Crest Pro Health has a component in it called CPC, which is also very effective at killing a lot of the bacteria that leads to periodontal disease. So Crest Pro Health or Listerine. Some people, Listerine is a bit too strong. So Crest Pro Health is a nice rinse. And even for Listerine, they do make a non-alcohol version, which can help relieve the burn and also not make your mouth feel as dry after using it.
So how about the natural ones, the ones that doesn't have fluoride in them? Are those effective?
So those rinses are good in terms of helping to reduce the flora or bacteria that grows in the mouth. A lot of times, like, it could be like Tom's or there's another guy named, it's a green bottle. What's his name? Dr. Katz, I believe.
Yeah.
Those can be good in terms of relieving the bacteria that can lead to halitosis, and also just reducing bacterial counts. In terms of their effectiveness compared to like a Listerine or Crest Pro Health, I would more than likely still take a Listerine or Crest Pro Health over those rinses, but those rinses do have components in them. Sometimes it could be aloe, which is very soothing for gums and also can help with periodontal disease, or just general taste can just be a lot more conducive to less burning in the mouth. So those rinses are still good. They're still good.
Okay, thank you.
You're
And I
welcome.
think we had that question about the wrapper and
Who asked you that question?
Yeah, last question.
look, we Eddie and I know who asked that question, but we're not going to mention it on
All right,
line here.
Good. So the question is, what is the benefit of a wrapper style gold grill or bling?
Bling.
So there is no benefit whatsoever. It's strictly cosmetic and to achieve a look. Typically those grills are removable. So, you know, you go into a function, you want your teeth to be gold, you throw in a gold one. You want them to be silver with diamonds, you throw a silver one with diamonds. The challenge with those is that if you're not mindful of your hygiene, and let's just say you're wearing it as if it's like your clothing every day and really not cleaning your teeth properly, that can be quite dangerous, because if you can imagine, our mouths are already filled with a lot of bacteria. You throw one of those things on, it's essentially locking your bacteria onto your teeth so that it can't go anywhere but sit there and grow. So if you're not cleaning your mouth appropriately, it can lead to a lot of problems. So for instance, there's a rapper, Lil Wayne, who had a grill, didn't take care of his teeth, ended up needing multiple root canals, ended up having that grill removed. All his teeth had decayed underneath it. So, you know, it's a look that some people want. I've never done a grill on anybody. I've done some gold crowns that people wanted, or platinum crown, but never done a grill before. And I don't think I'll ever do them. But I mean, they're out there. They're out there.
We don't do grills in Hyattsville area. Is that what it is?
No,
Or?
not too much. Not too much. Yeah, but they're out there. If you want them, you can get it.
Okay. Like, Dad, did you have more questions or?
Yeah.
Oh,
Still
Ebenezer Wesley is saying, "Don't mess with our bones." Chalet, I hear what you're saying, Mate, but it's not good cry, and yeah, good cry.
Okay, I think your brother had another question. For those who are scared of the dentist, how can they overcome their fears once and for all?
You got to take that first step, that leap of faith.
Baby step.
When Jesus was on the water with the disciples, you got to take that step so that you won't fall in the water. You know, and honestly, like, I'm somebody who is very, very much a listener. You know, I'm not somebody who's going to push treatment on you. I'm not somebody who's going to discourage you. I want to encourage you. I don't want to break you down. I want to build you up. So a lot of times people are just so self-conscious about their tooth condition. I've heard so many times, like, oh my gosh, you know, my teeth are so bad. I mean, honestly, I wouldn't have a job unless people had dental concerns. So I'm here to take care of those. So you should never feel ashamed. The only time you should feel ashamed is when you don't do something about it. So that's really my message. You know, just take that leap of faith. Just come on in. I got you covered.
All right.
Thank you. Yes.
You're welcome.
Thank you so much, Dr. Kwashi,
My honor and pleasure.
for coming back again. And I'm sure our family learned a lot in this segment, I should say, and are hopefully willing to take the baby step to see dentists if need be, and hopefully they will come and see you. So we appreciate you coming on this evening and spending all that time with us.
Likewise, I appreciate
you. If you can put the telephone number and the address again, I mean,
so the address is 3331 Toledo Terrace. That's Suite 308 in Hyattsville, Maryland, 20782. And the phone number is 301-559-1500. And if you're on Instagram, social media, you can find me there at Kwashi Family Dental. I also have a page on Facebook, which I don't really do too much with, more my Instagram page, but we're also working on a website, so that hopefully will be up in the near future as well. And I'm really just happy and ready and willing to just serve my people. I feel like it's the gift that the good Lord has blessed me with, and I want that gift to continue to be given to those who need it. So I'm here for you.
So if they were to Google you, should they Google you or your practice, and will that come up?
Oh yeah, if you Google Dr. Albert Kwashi, I'll come up. Okay. You'll see me. Yep. Mm-hmm.
So it's opposite the PG Mall, right?
Yes.
Yeah, PG Plaza. Yeah.
Across from where the old JCPenney used to be. Yep, directly across from that parking lot, 3rd floor.
Yeah.
All right. Okay.
Thank you. Thank you
You're
again.
welcome. You're welcome. My
We're looking
pleasure.
forward to another segment. So you covered a
Yeah, we
lot in
know.
this segment. Hopefully you have something else to talk about the
I
next
got
time you
plenty
come on.
to talk about. The
Yeah, a lot of
information is
things
on
to talk about.
The information is on DOS, so it's plenty.
Yeah.
Yeah.
Hey,
Thank
can
you.
you
And
say hi
thank
to John?
All right, I
yes,
will.
Can you,
John,
can you
yes,
see John?
yes. Thank you.
Hey, Obusiafo.
Thank you, John, as well, for your IT support.
Guys, so it's all good.
Yeah.
Thank
All
you.
right.
Well, have a
Okay.
wonderful evening.
you do the
All
same.
right.
Thank you, everybody. Take care.
Thank you.
Take
You
care.
too. Bye-bye.
Right.
Okay. So do you think we're running behind? I'm not sure if somebody needs the link or
Yeah.
not, but
Okay. So over to you, Rep.
okay. So, family, we hope this segment again was informative to you and your family. As always, please do share the link to this program as well as others so that others may benefit from it. Dr. Eddie and I will be back next week with our new guest with the S. We have Dr. Ricky Amorti and his sister, Dr. Vicky Duama. Well, both pharmacists, and they'll be talking to us about over-the-counter medications. So please make sure that you tune in for that segment as well. So if you have any questions or concerns, as always, please email it to emcyourhealth@gmail.com. Again, that's emcyourhealth@gmail.com. We thank you for watching. I know we're a little over, but we know that was a good program. So we're glad that you stuck around with us. And please continue to stay safe. We're still in a pandemic. Wear your mask, wash your hands, social distance. If you have not received your vaccines yet, please do consider doing so. We hope to see you next Tuesday. That's June 29th. Have a wonderful evening. Take care.